Excellent. Well, thank you everyone for joining us. It is 2:03 and we're going to try and be more punctual than the average webinar perhaps and get started. Thank you all. We have over 100 attendees currently and we know we have more who have registered, so hopefully folks will join us going forward. And then this is being recorded and we will share it back with you. So no worries there. My name is Adrienne Castellotti. I'm NACCHO's Chief of Government and Public Affairs, and I'm so glad to welcome you to this webinar where we're really talking about, now that the election is over for the most part, what does that mean for public health? Where are we going? And what do local health departments need to keep moving us forward, both through the current crisis and beyond? We are being joined by Eli Briggs and Ian Goldstein, who are also on our government affairs team. We'll be tag teaming in and out of this presentation, and so you will hear from them shortly. Next slide, please. So for those of you who don't know who NACCHO is or what NACCHO is, just quickly, as all nonprofits do, our mission and our vision, really, we are the local health department that represents the nearly 3,000 local health departments across the country, the association that represents them. And so all members of those health departments, we consider our members, and we try and be their voice, both in Washington and across the country. Next slide, please. NACCHO's advocacy arm is really particular to this group. And as I said, we want to be the voice of local health departments at the federal level. And we do that in a couple different ways. And we highlight the role of local health departments in Congress and the administration. We work to get federal funding to support local health department programs. We work to inform the legislation that establishes and continues key federal programs to make sure they actually work at the local level. Then we also try and train our local health department staff and officials to be strong advocates at the federal level, and also to translate that those skills at the state and local level. And then also to connect those constituents, those local health department staff, to their elected officials so that they can get a first-hand understanding of what happens in public health on the ground. Next slide, please. And so we offer a variety of services for our members. I promise we will get to all the good, juicy election stuff, but this is the underpinning of it and why it matters, and is how we can help you to kind of operationalize what we're about to speak, what we will be speaking about. So you can see the list here, but we have a Congressional Action Network we'll talk about a little bit later. We do a lot of meetings. We're taking advantage of these Zoom times and getting local health departments in front of their elected officials more than ever, because no one has to fly to be able to participate in that. We try and train folks. We have talking points and data and reports. And we are really trying to build these advocacy skills so that we can all advocate on behalf of local public health. Next slide, please. And just in case you're wondering, are we busy? Yes, not as busy as our members, but we are trying to work hard on your behalf here in DC via letters to the administration, meetings that are in person, advocacy alerts to our Congressional Action Network. We have podcasts, we have newsletters. We try and get local health department leaders on federal advisory committees, and we have a strong component of media work as well. Next slide. And this is all guided by our board approved legislative agenda. The new legislative agenda was just approved by the board a few weeks ago, and we will be formatting that and making it all pretty and putting it out there. But we will continue to have three main buckets of work. First is to push for strong investments in federal public health programs, including for emergency COVID funding and others, to build up the infrastructure of local health departments as well. Money is key to having the people and the resources to be able to do this work, especially in pandemic times. Next is really focusing on those people, right? Building the public health workforce. Thank you. Building the public health workforce, and we have legislation that was introduced this past year in both the House and Senate around how to help recruit and retain staff into local health department practice. And we actually lead a coalition of over 100 stakeholder groups, both inside and outside of public health, that is pushing for that on the Hill as well. And then we work in coalition to address all the public health issues that you can think of, and some others that you might not. So whether that's immunization or tuberculosis, food safety, vector control, injury and violence prevention, whatever that is, we work in coalition all the time to try and advance these activities. And we always are coming from a place of ensuring that resources, influence, policy is all being informed and trickling down to the local health department level. Next slide, please. All right, so here's what you came for. We have a lot of election results to run through, and I think Ian's going to take over from here to give us the rundown.
Great, thank you so much, Adrian. So yes, we did have an election. It was very exciting, and it's almost not even over yet. So next slide, please. So what happened in the 2020 election? What was on the ballot? The big prize was the presidential race, which Joe Biden is the president-elect at this time. We also had 35 Senate seats that were up for grabs, 435 House seats, which is all of the House seats. About 41 of them were competitive. We had 13 state and territorial governorships. We had 5,876 legislative seats. These were very important with the 2020 census and redistricting for the next cycle of elections. We also had 82 state Supreme Court seats, which is 24% nationally, that were filled, and 120 ballot referendums. Next slide. So the US House, the Democrats did maintain their majority, but they did lose a few seats. At this time, there are 13 races that have not yet been called, but the Democrats have the 218 seats for the majority. Republicans right now have 204 seats. And so we now have 57 new members of Congress, which is a lot of new members. Just want to give a quick highlight of the key losses. We had Representative Donna Shalala in Florida. She was a former HHS secretary and a great public health champion. She lost her seat. Also, Representative Colin Peterson from Minnesota. He is the chair of the House Agricultural Committee. He also lost his seat. Next slide. We have some new members that are from the health sector. We have 16 re-elected members with health backgrounds, but we do have 3 new ones. Diana Harshbarger from Tennessee. She is a former pharmacist, and she will be representing Tennessee's 1st District. We also had Corey Bush. She is a former nurse from Missouri, the 1st District. And Ronnie Jackson, you may remember him. He is the former physician to the president under both Presidents Obama and President Trump, and he will be representing the 13th District in Texas. Next slide. So we had some changes in committee leadership. Next slide, Cam. Are we stuck? Seem to be having an issue with the slides. It's stuck. Okay. 1 second. I'm sorry, folks. I am going to pause and share my screen.
While Ian is doing that, we talk about people who have backgrounds in health and healthcare, because obviously they have a unique perspective to bring to this, but it's also critical to see what committees they'll end up on. So while having the background is important, being on the right spot in the right spot to make those policy changes is also really important. And that's why Ian's about to run through some of the leadership of these committees, the ones that really have an impact on public health.
Yes, and as I said, the Agriculture Committee leadership, Colin Peterson lost his seat, so he will no longer be the chair of the Agricultural Committee. Actually, I think I skipped a slide here. Okay, so Energy and Commerce Committee, the ranking member, that seat will need to be filled. That seat was, I'm sorry, folks. Greg Walden had retired from that seat. And so the seat may be taken up by Dr. Michael Burgess. Kathy McMorris Rogers may also be up for that seat. Dr. Michael Burgess is currently the E&C Health Subcommittee Chair, so perhaps he could, or Subcommittee Ranking Member, and perhaps he could take that chair. On the appropriations side, Nita Lowy did retire, and so a new chairman or woman will have to be designated to the Appropriations Committee. And as I said, the Agricultural Committee. So for the Appropriations Chair race, this is a very key committee. This is a key committee for public health, for authorization of public health dollars, and authorization and appropriation of public health dollars. And so, as I said, Nita Lowy did retire, and so that leaves Representative Rosa DeLauro from Connecticut vying for that chair, as well as Representative Debbie Wasserman Schultz and Representative Marcy Kaptur. So the Senate, we had, as I said, 35 races, and the current Senate makeup is 50 Republicans and 48 Democrats. Republicans were able to flip one of those seats. That was Tommy Tuberville won in Alabama over Doug Jones, and the Democrats flipped 2 seats in the Senate. John Hickenlooper, a former governor of Colorado, took Cory Gardner's seat, and Mark Kelly, former astronaut, took the seat of Martha McSally. We also have 4 other new senators who were able to fill open seats. So January 5th, all eyes are on Georgia because the fate of the Senate leadership comes down to a runoff election on January 5th between incumbent Senator David Perdue and Jon Ossoff. They will be running against Senators Kelly Loeffler and David Perdue. Jon Ossoff and Raphael Warnock are the 2 challengers. So Senate committee leadership, there will be a little bit of a change. On the chairman's side, the Agriculture, Nutrition, and Forestry Committee will need a new chairman. I believe Pat Roberts was the chair of this committee and has retired. So there will be new leadership there. And there will also be new leadership on the Health, Education, Labor, and Pensions Committee, which was chaired by Senator Lamar Alexander. There are 2 senators that are up for that key slot, and this is a very key slot, again, for authorizing public health legislation, and that would be Senator Richard Burr from North Carolina and Senator Rand Paul from Kentucky. Both have very heavy tobacco backgrounds, so that will be a point of contention in the public health sphere, but these are the 2 gentlemen that will be vying for that chairmanship. So just to quickly run down some governor and state house races following the 2020 census, state legislatures will be drawing up congressional maps. Most state legislatures stayed the same. The GOP did gain control of New Hampshire legislature, and they also maintained key states of Texas, North Carolina, and Florida. So those very large states are key to redrawing redistricting maps. All governor incumbents that were up for re-election did retain their seats, and Republicans won open seats in Montana and Utah for the governorship. Finally, public health ballot measures, just some quick measures that did pass at the state level. Oregon and Colorado did pass tobacco tax measures. Colorado also passed paid family leave and medical leave measures. Louisiana passed a very restrictive abortion measure. Legalized cannabis was a big ballot measure this year. Mississippi legalized medical cannabis, while Arizona, Montana, New Jersey, and South Dakota legalized possession and use of cannabis. And finally, Oregon and Washington, D.C. were the first to legalize psychedelic therapies. I'm going to turn it over now to my colleague Eli Briggs, who is going to give updates on what we can expect in 2021. Eli.
Hi there, thanks Ian. And I do want to just let folks know, as we're about at the halfway point in the information we wanted to present to you, we really do hope that this will be an interactive time. We've got a bunch of folks on the line or on the webinar today who I'm sure you came because you have some questions that you would like answered. So you can enter those into the Q&A box at the bottom of your screen, and we will be returning to those at the end of the webinar. And like we said at the top, this will be recorded. So we will you will have it for your reference afterwards, but also want to get to as many questions as possible in the time that we have allotted. So as we just mentioned, the elections were just a few weeks ago, but Congress is coming back to DC. They're getting back to work. We have this sort of odd situation where people may have lost their seats or they may be retiring and they still have to come back to work for a few more weeks until mid-December. So COVID has certainly changed things everywhere this year, including in Congress. Hearings are continuing to take place, but are a lot of times on Zoom, or there may be some people in the hearing room and some people virtual. But Congress is still conducting their business and holding hearings. The issue of mask wearing within the Capitol and within the congressional public spaces of Congress has been a bit contentious, just like everywhere else in the country. But the leadership is really strongly imploring people to wear masks when they are in public. And like we said a little bit earlier, meetings are still happening with members of Congress and their staff. They're all just happening virtually. And if you are able to and willing to meet with your members of Congress and their staff about what's going on with COVID or any other issue that's impacting your health department, please let us know. We would be happy to facilitate setting up those meetings and providing you with all the help that you need to do those meetings. So that's a little bit about COVID. Then I just want to remind folks that, like I said, they do have to come back and work for the next week or so, and then they'll take the Thanksgiving break, and then they'll be back in December. And the 117th Congress begins January 2nd, and that will be when all the new members are sworn in. Next slide. So as usual, the Congress was not able to pass all of their appropriations bills by the deadline of September 30th which is the end of the fiscal year. They either have to pass all their appropriations bills or pass a continuing resolution to keep the government running, which is what they did back in September. And that continuing resolution runs out on December 11th. So if nothing else gets done in the lame duck session, the continuing resolution definitely needs to be passed, or they need to come up with a complete, what they call an omnibus appropriations bill, which would wrap all the appropriations for the next fiscal year into one humongous bill. And that either one of those scenarios needs to happen by December 11th. There is some talk that from leadership, from Speaker Pelosi and from Majority Leader McConnell, that they would like to wrap things up so that they don't have to come back next year and work on the previous year's appropriations. But there are some pretty serious differences that would have to be worked out. So it's kind of a 50-50 chance of whether we will get a continuing resolution through sort of February, March timeframe to take us into the new administration, or whether they are able to wrap everything up and then have the fiscal year 21 behind them when they get here next year. And this does mean that that there is a possibility for a COVID package still to happen this year, and we'll talk a little bit more about that in a minute. But again, a lot of negotiations between here and there. Next slide. So COVID-19 emergency supplemental funding, something that at NACCHO we've been working on pretty much constantly since February. You can see that there were 4 bills that were passed. March and April were sort of the hot time for both for the virus and for funding packages being passed. And we were successful in getting quite a bit of funding through billions of dollars of funding for the public health response through these various bills. However, since April, there really has been a stalemate and gridlock, stopping anything more from happening. And we have continued to push for the needs of our members, but the negotiations just have not been fruitful up to this point. And this stalemate may continue through January up to Inauguration Day, unfortunately. We really do need to keep the pressure on and keep advocacy moving forward to members of Congress, so that we can make sure that they are aware of the needs of public health today to get us through this crisis, as well as invest in the future of public health. Next slide. And so just the status, there are a lot of words on this slide, so hopefully when you get the recording, you can go back and take a look at it. These are kind of the two positions that have been set out by the two sides, which are the House Democrats and the Senate Republicans. The House has passed a couple of different bills. Most recently, they passed a bill that the total is 2.2 trillion with a T, which includes 75 billion for the public health response. And then the counter to that in the Senate, the Republicans put up a bill that had about 15 billion, and it had other things as well in it. But there is really not the same desire to spend as much money in the Senate as there is in the House. So that's where the negotiations are sort of breaking down at this point. Next slide. So at this point, I'm going to turn it over to Adrian, who's going to talk about the presidential election.
Yeah, so you might have thought we forgot about that, but we didn't. There's a method to the madness. One of the key points that Eli just was talking about and was on that slide is, you need 3 folks at the table pretty much to get anything through for a COVID supplemental package. You need House Democrats, because that's who's in charge over there, Senate Republicans, that's who's in charge over there, and also the administration. And at any given time over the past few months, you've had 2 of those 3 players willing to negotiate, but not all 3 at the same time. And that's now it's kind of in a more challenging way. It used to be the administration and the House Democrats were talking to each other, and Mitch McConnell in the Senate was putting the brakes on things. Now it seems like he's willing to come to the table, but the president has not been pushing that same level of interest in trying to find a deal. And part of that is because of the outcome of the election for the president. So Joe Biden has been by all accounts is the next president of the United States, and at the same time, a form needs to be signed at the Government Services Administration, and that is not being signed to allow for the formal transition. Every time there's a change in administration at the presidential level, there is a kind of a time crunch of overlap where the current administration is still in charge, but the new administration is starting to learn and do transition planning and really trying to understand what's going on so that they can hit the ground running on January 20th. That is not happening in a traditional way right now. And so we are seeing a lot of announcements out of the Biden-Harris team, but not as much of the action as you normally would at this point in time. So the Biden-Harris team has announced a COVID-19 task force, specifically with lots of some big names up there, including a former local health official from Chicago, Julie Marita, who's at Robert Wood Johnson Foundation now, as well as agency transition teams. They're supposed to be engaging to understand, what's the status of any given agency so that they can hit the ground running on January 20th. Those conversations have been stopped, but those transition teams have been talking to outside groups to try and get as much intel as they can right now. That's one of the places where NACCHO is supporting our members by making sure that the incoming administration kind of knows our status, knows what we need, and knows how to work with us going forward. Appointments for cabinet positions is going to be one of the first things. You started to see in the past couple of days some of the high-level advisors to the president who've been announced of who will be in the White House. And really next we'll start seeing the announcement of different cabinet officials. The Senate can start doing their proceedings in the beginning of January to have as many people in place or ready to be in place when the transition formally happens on January 20th. There's a lot of questions right now, and we can get into this more if people have questions about it in the Q&A time, but of who's going to be put up for different posts. Given the unknown makeup of the Senate, does that mean you have, does that impact who the Biden team will put forward to be like, okay, this person I think can make it through a Republican Senate versus this one would be easier to get through if there was a democratically led Senate, democratically led Senate. In the meantime, there are acting directors, and oftentimes these are career people who are kind of in place in these transition times traditionally. But one of the interesting things is that the CDC director doesn't have to have a Senate confirmation, so that's something that can be done pretty quickly. So we're certainly keeping our eyes on that, given that that's the leader of our governmental public health response. Next slide, please. And then there's some early actions that can be taken by the Biden administration without having to work through the cogs of Congress, which we love, but so he's already announced rolling back some of President Trump's changes, which were rolled back changes of the Obama administration. So things like rejoining the Paris Climate Agreement, recommitting to the World Health Organization, putting back a bunch of environmental regulations. There has been talk about how he might change kind of the impetus of using the Defense Production Act to ramp up activities for COVID response, possible mask mandates, and then also an issue that we hear a lot about from our members. There were changes that the Trump administration made to the public charge rule that were kind of made it more challenging, either perceived or real for folks who are undocumented to get the services that they need. And changes in that are on the table as well to put that back to the way the law had been, or the rule had been. Next slide, please. So of course, we have a lot of things to say and a lot of suggestions for how the new administration and the new Congress can tackle both COVID and help us get through the pandemic, but also what local health departments need long-term. So I'm gonna walk through a couple of those right now. This is our most condensed version of a 13-page document. So we encourage folks to go to the link and get all the background information, which is now in your chat box. Next slide, please. So our transition recommendations, the first is really to support local health departments who are on the front lines of this COVID response. That means additional investments for the whole governmental public health response, federal, state, and local, and getting money designated specifically for local health departments to try and cut some of the red tape that's delayed and the ability of money to actually get to the front line so that our local health departments can actually spend it on their response and to gear up for the mass vaccination campaign that we know is coming for COVID-19. We'd like to publicly track those dollars too, because I think there's a lot of confusion about if local health departments have what they need and where federal dollars are going, and that will help us identify where best practices for getting those dollars through the system quickly. And then we want to ensure that federal grants and funding announcements recognize the expertise of local health departments. Local health departments don't always get the grants directly, make plans themselves, just for themselves, but they have an expertise of what's actually going to work and what's actually necessary at the community level. We want to make sure that their expertise is included in these broader plans. Next slide, please. Next is to strengthen governmental public health partnership at all the levels, and to harness the expertise from the local level and national planning. And we recognize that, it's critical that we have clear federal national plans, but they need to be informed by what's going on the ground level. So that includes, in these transition teams and in these task forces, ensuring that they get the on the ground practice experience, like what are practitioners hearing and seeing and doing right now to help inform what those national plans should be. We want to make sure that, there are a lot of plans right now that are being written both at the federal and state level, that local health departments are meaningfully included in those so that we can ensure that they have the information that will actually make them successful when they're implemented. And then also informing and consulting with local health departments when federal actions are going to take place within their jurisdictional borders. That seems like a pretty straightforward thing, but unfortunately over the course of the response, that's not always been followed. And local health officials need to know what's happening within their jurisdictions, both to support it and also to help ensure that the community understands what's going on as well. Next slide, please. This is the only place where we really call out a particular piece of the COVID response, but it's absolutely critical. We must invest in the COVID-19 vaccine deployment and infrastructure. The federal government has invested billions and billions of dollars in bringing vaccines through the development phase. And we know that there are two leading contenders, both one from Moderna, one from Pfizer, that seem to have incredible, that seem to be incredibly effective, and they will be going for clearance through the Food and Drug Administration soon. But if those things are cleared and all those vials are sent out, and we still need deployment efforts of local health departments and their partners to actually ensure that people get vaccinated. And that takes funds and that takes time and resources. So as part of Coalition, we're asking for at least $8.4 billion to really step up the funding to build those systems and to build them out to the scale we need right now. This cost may continue to go up as their confidence in these vaccines over time has really gone down. So messaging, communication, ensuring you're really reaching people where they are is absolutely critical, and that's really time intensive. We also want to make sure that local health departments are involved in the planning discussions so that they're ready to go once and that their needs are met once a vaccine is available. Next slide, please. We need to restore support and trust in public health. I know we already have a question about this in the chat box. The politicization of this response has made it incredibly difficult for our members to do their job on the ground. And we also see that playing out in the way that cases continue to spread and spread. Part of this comes from this real need to have clear, consistent, and science-based guidance at all levels. We need to all be talking from the same script, having the same evidence-based information of messages that actually work. There's been far too much kind of mixed messages coming, and that makes it really hard for a local health official and local health department staff to do their job and to follow science-based recommendations and implement them locally. We need to support and protect the statutory authority of local health departments to take action and protect the public. Part of that politicization is in certain states and areas seeing legislation that's been out there to try and strip health departments of their authorities, whether that is to regulate certain parts of their communities or to put in orders for things like quarantines and shutting down. Those have incredible impacts both for COVID right now, but could also really impact just the broader ability for public health departments to do their job in any given sense of the word, and really is a huge issue for what they can do now and into the future. We need to ensure that local health departments also, we're trying to also push to make sure that local and state health officials have the same legal protections as federal employees during the response. Had to condense this one down a lot. We have seen far too many, one would be too many, I wish the numbers were that low, of local health officials and staff receiving death threats, violence said against them, people who have had large caches of weapons who have been saying these things, who have actually been prosecuted by law enforcement. Those are the rough ones, and then just the general disrespect of public health and local public health departments. We've lost, I think we continue to count how many local health officials we have lost over the course of this response. We're somewhere upwards of 90 now, and that's just who we know and who we can capture through media combing and stuff like that. That's expertise that's lost. That is critical leadership that is lost. And that's coming because in so many ways, either they're personal or professional threats to them and their family and their work. This federal official, if anyone who's a federal employee has certain protections legally that don't necessarily translate down to the local and state health department level. So we want to make sure to bring that attention to the federal level of what's going on and how our folks are faring. And then we also want to clarify that federal funds can be used to provide security for local health officials and staff if necessary, because unfortunately in some communities, that's how far it's gotten. It's grim, but really we need to do all we can to support, to restore the support and trust in public health. Next slide, please. And then we need to think long-term, right? So much of COVID is every 2 hours seems like 2 weeks and changes over and over and over again. The virus has really highlighted a lot of the cracks in the existing system. And these are cracks that will not be fixed by the end of the pandemic, and they may actually be exacerbated by the pandemic. So we really need to be thinking long-term as well. So one is public health infrastructure. We support a public health infrastructure investment, mandatory federal funding to build out the base of health departments, and particularly getting those dollars to the local health departments, which see such variance in their capabilities and resources across communities. And then kind of overall, we need to really break this cycle of boom and bust funding. So usually there's a crisis and we throw a bunch of money at it, and then the crisis moves away from the front pages and then we stop funding. And not only is that not particularly effective that's not particularly effective for building out your infrastructure and being better prepared for your next crisis, but also it really doesn't leverage the dollars that have been invested that well. And that's absolutely critical, that we are, being good stewards of these tax dollars and saying, well, we're going to invest in this and then we'll maintain it and we'll all be able to benefit from it in crisis time or in peacetime. We'll go with that. Workforce is the key issue that we hear day in and day out from our members. And so that is, as I mentioned earlier in the legislative agenda, that is our key, the key work that we do and that we push in Congress. One way that we're trying to do that is through a loan repayment program that is modeled after the National Health Service Corps. That would help recruit and retain folks in local and state health departments. And those bills have been introduced. They've been included actually in the HEROES package, some of the large COVID packages on the House side, and we'll continue to push those things, but they really need to not only be enacted, but funded and built upon long-term. And also increasing investments in the Medical Reserve Corps. There's a lot more interest in volunteering with local health departments these days, and we have mechanisms to facilitate that. But what we really need to do is ensure that that those are strong so they can actually help harness that volunteerism for local health departments. For all levels of government, thinking about health and all policies for your policy program and budget development. That's something we talk about a lot in the local health department space and sometimes in the public health space, but not as much in the policy and government space. And so we draw strong attention to the importance of that as people now better understand how non-health policies impact health. And they also now understand how public health and health policies impact all the other sectors of public life. And then data modernization. So much of many of the challenges of the response have been not having the information at the level we need it, when the level where we need it when we need it. And there's a lot of investment right now going into fixing this at the federal level, but the local health department systems can't talk to the state and federal systems. They can't pull down data in a timely manner and use that in a bi-directional way. We really won't be as successful as possible. And so we need to really invest in that at the local level as well. Get better access to electronic case reports. Some areas need broadband. There's a lot to go into that infrastructure, but it's certainly something that could benefit us in COVID and well beyond. Next slide, please. And then finally, for all the doom and gloom, here's your positive side. Our local health departments have been working nonstop on the pandemic response. Their other programs and projects have been impacted greatly, both by pulling workforce off of those things, but also, and resources, but also the physical distancing and social distancing that we all have had to do to make it through the pandemic. And they've been creative to really find ways to keep their doors open, their programs running. And they've actually found some efficiencies that would like to continue forward. So this could be examples of things like video-directed observed therapy for tuberculosis, a lot more self-testing and express STI testing, some telehealth visits, virtual check-ins for programs like WIC. We've heard a ton of response from local health departments about how important that change has been for them, and other ways to virtually engage with communities where they're getting new voices at the table. These are things that all should be looked at to continue long-term as we move into the future to make these programs more efficient and effective. And then also, we need to think about any of the investments in COVID and how we can leverage and build upon them long-term. The example I like to use is building out our vaccine infrastructure for getting COVID vaccine out there in mass deployment. Every year, that the pandemic will be over at some point. They're knocking on all the wood, right? But every year we have a flu campaign. Every day we're trying to find children and adults who are not getting the vaccines that are recommended for them based on their age and health status. And so we can and must actually invest in these systems now, but actually long term, so we can all benefit from them while the crisis is going on, but also long into the future. Next slide, please. So we're going to run through real quick just some of the ways to stay involved with us, but then we're going to get to questions and answers. And thank you all for bearing with us as we turn to that section. Eli?
Thanks. Next slide, please. So I'm going to run through quickly some ways that you all can get involved because you chose to take an hour out of your day to join us. You are showing that you're engaged in these issues. And so one thing you can do is go to our website and download our advocacy toolkit. This is something we started putting together a few years ago, and then we update it annually to kind of give you a sort of a how-to kit about how you can get involved. If you don't know the first thing about how to engage with your members of Congress, it walks you through a lot of that information and provides talking points, provides sample meeting request letters. And so that is all there for you, as well as you can always contact us once you download the toolkit if you have any questions or there's anything you'd like to get more information about. Next slide. We also, as mentioned earlier, have a Congressional Action Network. This is made up of the folks within our membership who are most engaged in advocacy and really want to know when something is moving in Congress where they can make their voices heard. And we know you are all very busy, so we try to make it easy for you. We do not send you emails constantly, but when there is something that is coming up for a vote or something where we really need to pressure Congress to take action, we will send alerts to our Congressional Action Network, and they will be sort of the first ones who see what's happening and also how they can take action. And as you can see there, you can text Join CAN to 50457, and that will get you engaged in our Congressional Action Network. And all mostly the communication after you text Join CAN will be through your email. Next slide. We also have a weekly newsletter, and I always say, people are probably getting sick of hearing, my coworkers probably tired of hearing me say, I'm still waiting for the week when there's no news to put in our newsletter, but there's always something going on in Washington that has to do with public health. And so we try to condense it into a easy to read sort of digest of everything that's happened in the past week in Washington that touches on public health. It goes out on Fridays. So then you can hopefully read that at some point during your Friday or on the weekend, and then you'll be caught up on everything that happened in the past week. And you can see how to subscribe there or just email Ian and he will help you get signed up. Next slide. We also have a podcast, which is sort of Ian's baby. He's the host and I co-host and try to fill in some information. We also give you the rundown every 2 weeks on the podcast of what's going on in Washington. And then there's always a guest who drills down into a particular issue. So some during COVID, some of them have been COVID related, but some of them have been, looking at other issues like chronic disease or opioid abuse prevention, things that are still going on, even though that we're in the midst of COVID. So you can search for the podcast series in any podcast app that you have, and please review and give us feedback. That helps us to get more listeners, and it also helps us to know what you like and what you want to hear more of, and what we should continue doing. So So thank you for those who've given us reviews. Next slide. And here we all are with our pictures and our emails. That's the best way to reach us. And we really do love hearing from members about what's going on and how we can help you. So with that, I'm going to turn to questions. We have had a few come in on the chat. I'm going to first go to the question from Melissa. Has there ever been discussion of moving public health funding into the federal defense budget? I've not heard that. I guess the idea there, she's saying, you know, we're all fighting different wars and there are global and national repercussions, and we fit into the national security structure. I have not heard of moving our funding into the defense budget, but there was an effort this year that I think it sort of stalled out, but I think it will be coming back again. This is something that former CDC Director Tom Frieden was very much a part of. It was a health defense operations budget, and what the idea was that some accounts within CDC would be moved into a mandatory side of the budget, so that then they wouldn't have to come every year and fight for appropriations along, you know, in the health space. There's a lot of equally worthy types of programs sort of competing with each other. And if you took out these health security programs and made them mandatory, then they wouldn't have to, there wouldn't be this feeling of an increase for infectious diseases taking away from chronic disease or something like that. So that was one idea, to sort of take some of the health security programs and move them off into a different budget so that they wouldn't have to go through the annual appropriations.
Yeah, and that I mean, I think that's a really actually when you put that in, Melissa, that's exactly what I thought of, is this idea of making a health security fund. So whether it's mandatory, it would be taking it off the budget cap rolls. So it's kind of like the war contingency funds that go on in the defense budget. So that doesn't actually get captured in the budget. The federal appropriations process is pretty complex, but pretty much each, there's 12 different bills which cover all the different federal agencies. And each of those bills gets a top line number. This is how much you can spend. Well, labor, health and human services, and education departments are all together under one bill. And those are all very expensive programs, and they're never given enough money. So it's really a sense where you're like, okay, we could up childhood vaccines, but we could also cut early education. You know, there's just a lot of false choices there. And so by pulling those off, one of the things that's happening right now is people now understand how important preparedness funding is, and yet there's not a lot of money in that budget cap to put it anywhere. And also, unfortunately for public health, we're in the same bill as NIH. NIH is loved in a bipartisan way, as they should be, but they're always guaranteed more and more investment, and so that leaves much less for the rest of us.
All right, we've got a question from Catherine Troisi. What are the Dems' chances in Georgia? Is one candidate more likely to win than another?
So Georgia is going to be really interesting. Georgia has their state law just says that whoever's going to win their Senate seat has to win by a 50+ majority, and so otherwise it goes into a runoff. So both of these Senate races, and the reason they had 2 Senate races in the first place is because they had a seat that was filled out of cycle. So when that happens in the Senate, someone gets appointed and then they have to, at the next election, actually run that seat. So you'll never, in a typical year, see 2 seats in one state, let alone a state that then has that 50+ requirement. It's really going to depend on a lot of factors. So one is runoff elections tend not to get as many people voting. At the same time, the electorate of Georgia and who actually came out to vote this last time is very different than what's been there before. There's been a lot of concentrated efforts within Georgia to mobilize their own voters. There is, however, now, you know, all this attention being paid nationally to these Georgia races, and that can sometimes backfire. It's really helpful for financial resources for candidates, but at the same time there can be a backlash of, I don't want everyone, I'm from New Jersey, I don't want them New Jersey people messing with my Georgia or whatever, you know. So trying to figure out who how that plays out, who's going to vote. But if it's really a change in the electorate and who's going to vote, and those are going to be avid voters, it'll be interesting to see how that plays out. We'll know January, well, and we just saw with Georgia how long it took to count those votes too, right? So we could say we'll know January 5th, 6th, 7th, 8th, but as soon as we do, that will really put a lot of things in play in the Senate with and different strategies.
From
So
Ingrid,
Adrian,
okay. Go ahead, sorry.
we're getting a question in the chat about the likelihood of the COVID-4 package in the lame duck session. We covered that briefly, but do we want to go a little bit more into that topic?
Oh, sure. News. So today or yesterday, they're all the same. Nancy Pelosi and Chuck Schumer, so the head of the Democrats in the House and the Democrats in the Senate, sent a letter to Mitch McConnell saying, hey, we need to get to the table and we need to pass something. Mitch McConnell, Republican senators pointed out that if you release that letter to the media and don't just send it to the person, are you really there to really, do you really want to negotiate, or is it more for the media? We don't know what their intentions are. But that's kind of the level at which we are stuck of what is going to get done, or if anything. You know, we could get a deal on COVID that gets attached to emergencies, or not to the government funding that needs to be passed by December 11th. But we could also see some, high profile items pulled out of the emergency supplemental conversation and just stuck to the government funding conversation more broadly. So something like vaccines. At this point, there have been $0 appropriated for vaccine deployment from the federal level. And so I think Congress is hearing that loud and clear. I wish they had heard us more in the spring when we were asking them to do this in advance. But pulling that out could be good for vaccines, but bad for the rest of the things in public health that we need to have funded. So there's a lot of challenges there. And then if Mitch McConnell and Nancy Pelosi have a deal, there is absolutely no guarantee that the president will sign it. He still hasn't conceded defeat in the election. He's very focused on some judicial avenues to try and get at that. And that's really where his focus is. And it's hard to see what his motivation is for signing a law like that, unless he feels like there's something in it for his legacy, or unfortunately, his press secretary today just called some of the COVID restrictions that are going on Orwellian, in that people should be able to go and do whatever they want for Thanksgiving. So there's a lot of mixed messages coming out of there, and it's unsure if he would sign something, even if it passed, unfortunately.
Thanks. And we have a couple more minutes, and we're going to try to get to a few more questions. There are several questions along the lines of what you were just talking about, the authority of local health officials and state health officials being challenged, as well as CDC, which has really, I think, lost a lot of goodwill from the public because they are now seen as more political as they used to be. Possibly not by their own choosing, but that has happened. So folks are asking, how can we change that, and how can we get back to where the public trusts public health officials, basically?
This is a huge question. It's a huge problem, and I think it would be disingenuous to say that this is something that can change quickly. There is a lot of trust that needs to be rebuilt. Local health officials and local health departments have long been well-trusted pillars in their community. And I would say, despite what we have seen in far too many areas, that still in the vast majority of communities, that is true. That remains. You all have worked really hard for that. And it might have dimmed a bit. It's not, you are still trusted advisors. And I think if you just go listen to the phones, you'll hear how many people care about your opinion and what you know and your expertise. So we're down because in any way that it's being challenged, but vast majority of areas, local health departments still really are those pillars. That being said, from the federal level down, any impact, any negative impact on public health trust impacts all of us. And it's going to take a lot to rebuild that. I think the designation of who's going to be the next CDC director is really important, both in their background and also their ability to communicate, but also how are they going to be pulled into the strategy? What level of leadership will be placed upon CDC moving forward? And I think that's another important piece. So, it's not going to be an easy road, but it's definitely something we'll all be working on together. And NACCHO is working on lots of different communications collaboratives and other areas where we're trying to build that public trust and support. And if there's ever particular questions you have, let us know, because we really are here to support you as best we can.
I think we have time for one more.
So yeah, thanks, Ian. So there's a question about billing for vaccines. Would we consider advocating for a national free billing system for vaccines? And that is one of the things at issue in the COVID relief package negotiations, is whether vaccines will be completely free with no copay for folks, as well as the funding, needing the funding to be there for the administration side of to support the healthcare providers in giving the vaccine. So this is very much under discussion right now. I guess one more question I think we can get to, and then we'll probably have to wrap things up. Any chance of a representative from ASTO, NACCHO, and APHA on the new COVID task force? I'm assuming you're meaning the Biden administration task force.
So I think, right now, they're doing a lot of announcing of who these groups are. And that's one of the reasons, we are pleased that we've been able to talk to the transition teams and make sure that they understand what expertise they have on that panel and what might be missing. And so whether or not there's formal representation or abilities to influence those conversations, to provide direct feedback, is yet to be seen, but it's certainly something that we've started having those conversations about. It's why we put it specifically in our transition document. One of the reasons we'd waited on our transition document until after the election is to really be able to tailor it to whatever the situation was. But this is also my chance to give a plea to you all. I know people are dropping, so don't drop until you give me all your information. We need your help. We need your expertise. We need to know what's happening on the ground in your community, because that is the best way for us to ensure that it's getting to the ears that need it. And this is something that, in our News from Washington, we're constantly asking, hey, let us know. Give us what's going on. Do you have a problem? Do you have a question? What's going well? That information goes directly into our advocacy work, directly into our media work, directly into our programs work. And so the more we know about what's going on in your neck of the woods, how we can support you, what's missing, the more likely we are to be able to get that in front of the right people and get something changed and changed quickly. It's a perfect way to end our session. Well, thank you everyone for joining us. This is really fun for us and also hopefully informative for you. If you have questions going forward, please, please, please don't hesitate to reach out. Please join all of these different things we talked about of how you can stay involved with NACCHO, and we look forward to talking to you soon. Thank you.